Hey everyone, welcome to the Jaw Talk podcast. I'm your host, Dr. Tiffany Lamberton, and I got to get real here. I've been pretty sick and just trying to be a solo entrepreneur, having a podcast in my house. You'll notice that this next episode is not perfect. So thank you to my guest, Courtney Scaggs, who was an absolute rock star. And I love talking to her. And you guys have to check out her Instagram at Space City Speech. She's not only an expert in speech language pathology, but also a leader in integrating speech therapy with dental practices. And if you've been listening to the podcast, you know I'm all about interdisciplinary care. So she really is a huge advocate for that. And I love how we touched on that. Courtney has a Master of Science in Communication Sciences and Disorders from Radford University. She has an extensive background in pediatric and adult speech therapy. Courtney brings a wealth of knowledge and innovative practices to our discussion. So today she'll share her journey into myofunctional therapy and how interdisciplinary collaborations are revolutionizing patient care. So thanks for supporting Jaw Talk podcast, and let's dive right into the episode.
Quick legal disclaimer. All information in this podcast is the opinion of the speakers and not meant to be a substitute for a diagnosis and consultation of a qualified healthcare provider.
Hello, TMD Collective community. This is Dr. Tiffany Lamberton, and this is another fabulous episode of Jaw Talk. I'm so excited for my guest today, Courtney Scaggs. She's a speech language pathologist, and I just love the name of your practice, Space City Speech. Welcome to the show, Courtney.
Thank you so much for having me. I'm excited to chat with you and just chat about my business and what I do.
I know. Well, tell us, how did you go from speech to kind of getting into orofacial myofunctional therapy?
I think that my story is a little bit outside of the norm. I just had an event at my office last week where there was a bunch of myofunctional therapists that were gathered. And I was one of the younger people there, but I also have been in myo longer than most of the people there. Myofunctional therapy fell into my lap. And once that box was open, there was no looking back. You can't unsee it after you learn that. I moved to Texas to do my final externship when I was in grad school. And 2 weeks before I was scheduled to move here, my placement fell through. So I just started cold calling places and trying to find someone that would take a student. And I found someone, and they just so happened to be the president of the International Association of Orofacial Myology. So I did my externship there, my clinical fellowship there under a certified orofacial myologist. So my whole career in speech therapy started off with myo.
That is so cool, because a lot of times people practice for a while and then they start to hear about it, and then but you were there at the get-go. That is so cool.
And it was so nice to have mentors that I got to learn from hands-on as I went. I really took my certification process really slowly because I just had so many great people to learn from. That hands-on experience was so important for me to feel like a confident clinician.
Yeah. Well, a lot of our audience are dentists. And so tell us a little bit about, how did you make inroads with the dental community? Because, I feel like, maybe there are some more like Airway focused dentists but not everybody is supportive or really like well informed about OMTs. Like, tell us about how you started to kind of, get into the community there.
We are so lucky here in Houston. We have such an amazing just Airway community. Our resources are crazy. It's so nice to have options to be able to give our clients when we're referring out. I really just started working relationships with dentists. If it's one of my intake questions is, who's your dentist? Because there's a pretty good chance we're probably going to need to communicate at some point in time. So just building those authentic connections kind of slow and steady early. And then I took a contract inside of a dentist office. So I was seeing speech and myo kids inside of a dental office. And that was a huge jump in that kind of networking process. I learned so much more about the insides of things than I would have originally known. And most recently, I spoke at the Pediatric Dental Association meeting here in Houston. And it was just a huge collection of airway dentists, regular pediatric dentists, people wanting to learn more. And so starting to build some more connections there as well. Just authentic human connections, I think, is the biggest part of that.
Good for you. So with our dentists that are maybe not as familiar, give us like the little like 101, like what do you do and what do you offer for our young patients?
I always tell my dentist that the big things that you can help me screen for, I say dentists are some of the best screeners because you are looking and talking about exactly what we need. So I always say, and just in terms of speech, if the child's speech does not sound like his peers, that's a good referral time. Open mouth breathing is another one that you can, these are things you don't even have to ask about. You can just observe in the dental chair. And habits. So thumb sucking, chewing, pacifier use, anything like that. Those are some really big things you can kind of pick up on just by seeing the child in your chair. And most of the time, the other myofunctional goals like resting tongue posture, resting lip posture are probably going to go along with those things that you identified just by being with your patient.
Yeah. So one of the things, that I like to preach to is just, really looking at kind of like the big picture of the patient of not just, how the teeth fit together, what their bite or their occlusion is like, but like you said, looking at the airway, looking at the structure that's happening underneath. And I would say, in my practice, one of the hardest patients is, kind of what in the dental world we call that class 2 or retrognathic patient, or maybe they have an anterior open bite. So what are some of the strategies? Like, tell us a little bit about like your process and when you're evaluating kids that do have, mouth breathing or anterior open bites. What are you bringing in?
We kind of look I always say that speech therapists with myo training are kind of like a unicorn because we are able to look at a really broad range of functions. My evals, when I have someone come in for myo, we do a full articulation assessment so I can see the functional impacts of structure and function on their articulation or their speech sound production. A lot of times, parents will be, "Oh, they sound fine, they sound great." And then watch them produce the sounds, and I'm seeing their tongue thrusting or creating that space in between the teeth. And so, even though it sounds great, we're having functional impacts. And
Or the
then we
parents will
also,
be like, "Oh, that's cute." They say that, like, and we're like, "Actually,
yes.
that's not true."
Yes, I was just talking about that with the parent yesterday. She was like, "Do people think this is cute?" And I said, "All the time, all the time." It was a little thruster. And then on the flip side of that, we also are able to look at the swallow function. So we sit down and eat a snack together, and I'm looking for chewing pattern, swallow pattern, just seeing how everything is working together. Because just because someone has abnormal structures or something that's outside of the norm doesn't necessarily mean that they need a speech therapist. If they're functioning well, I let function drive all of my decisions. So just getting a really big functional overview. There's a lot of parent interview too. I want to know about sleep. I want to know about breastfeeding. I want to know about transition to solids, attention at school, behavior at school. I talk to the parents a lot. That's a huge part of my evaluation process.
I love that. And then one of the things, we sometimes get a lot of pushback from our orthodontists about like some of the early interventions. What are some of the things that you say to kind of, again, like the parents as far as like advocating for that earlier intervention?
Yeah, that's a big conversation. And what I try, once again, is just function driven recommendations. So I just told a parent last week that I am not an orthodontist. I wish I could have all those trainings for myself, but I can't make specific orthodontic or dental recommendation. But what I can do is write a report that's telling you the exact functional impacts that I'm seeing for the structures as they are. So I try and really drive those points home. I have noticed in the last year that there's been a lot more open mindedness for early expansion. Other things still a work in progress for the early intervention, but a lot of the providers here are kind of getting on board with early expansion. So that has made things so much easier. It makes progress go so much quicker when we get the structures in the right place first, and then we're able to target the speech sounds.
Yeah. So what's kind of like your patient population is, a large percentage, I'm guessing is like 5 to 15, or what would you say is
Yeah.
like the bulk of your practice?
I see such a diverse caseload. My youngest I see is 6 months, so I don't do any bottle feeding or breastfeeding because I have a wonderful group of therapists that specialize in feeding. So I send all of this to them 6 months and up. And 6 months, we're doing a lot of just early pre language skills, super speech and language based. But then most of my caseload is 3 to 6 years old. I see a lot of preschoolers and a lot of kindergartners. That's the big bulk of my caseload. But I do see all the way up to adult as well. So we see a really wide variety of patients.
That's fantastic. And then one of the things, that I am a big advocate for is, just once you've done kind of your comprehensive exam and your workup from the dental standpoint, I'm also a big proponent of kind of like modern imaging. So we're in an age now where digital dentistry and some of the things that the tools that we have really give us a lot of insight of, what's happening. Let's say you have a low radiation dose cone beam CT that you can see kind of the osteostructures of the jaws, upper and lower jaws, and how, the joints are and how they fit together. Is that something that your dental colleagues are sharing that with you? Tell us
Yes.
a little bit about that.
Definitely. I was just talking to a parent about this yesterday. They had a CBCT scan and they were like, we don't really know why we got it done, but we have concerns about mouth breathing. And it was nice to just kind of be able, they shared it with me. We were able to talk about the structure and the airway all the way down, which is such a huge thing to have, especially when treating adults. Most of the time, will not move forward with a pre or post release patient that's an adult if they don't have a CBCT. I want to ensure that they have the airway to support that. And most of our dental partners that we work with here use CBCT really consistently and regularly.
I love that. Another thing that I'm a big proponent of also, my patient population is a lot of adult patients that have TMJ pain and dysfunction, where it's been, kind of a lifetime that we're trying to like unravel some of those things. And one of the things that we found is when we also combine CBCT with MRI to look at the soft tissue of the TM joints, I'm starting to see, young girls that are even as young as like 12, 15, where, maybe they've already gone through their orthodontic treatment and their joints are starting to break down. And we're seeing that the disc is dislocated. I had a 15-year-old where, her maxilla didn't grow to its full potential. Her mandible was back. And, we did the MRI of her TM joints and her disc was dislocated in all of the positions. And it was like a big doorstop. So even when she tried to open wide, her disc was just locking her into that position. And so here she is, 15, kind of looking at a lifetime of compensations with muscle problems. Already you're starting to see the deviation of the jaw and, like tension sometimes in in the mentalis muscle and, in the neck, all of these compensations. So trying to get the dental community on board with, some of this, sometimes we need to do, a little bit more looking under the surface of not just the osteostructures, but also the soft tissue structures.
Yep.
So what's been your experience with, kind of that part of growth and development with your dental community?
It was gonna put a pin in that and come back to it because I really liked what you said there about how you catch a lot of adults who are need jaw work, having jaw pain. Because I always say we catch like airway concerns, structural and functional concerns at a couple of different stages in life. And that jaw and sleep is the last stage that I feel like we catch people who have flown under the radar for the other kind of areas. A lot of times we'll see babies who are having a hard time breastfeeding The next kind of catch-all is kids who are having persistent articulation errors. They just cannot succeed in speech therapy. And then the next group that I kind of catch people in is orthodontic relapse, when they've had braces and things still aren't working the way they want to. And then that next group is jaw pain, sleep apnea. And that's a really, really hard pattern to break, compensation to break. So it's interesting. I liked that that's your population. You're working with the tricky ones.
Yeah. Yeah, it is hard. And unfortunately, when a lot of times when we have clients that get to that point, like you said, with, really significant jaw and airway issues, they're frustrated because the options for treatment are either, they're kind of either like conservative therapy with like PT and maybe splint therapy, or they're looking at some type of jaw surgery. And I do feel like TMJ surgery has kind of been thrown under the bus a little bit lately. I just on my podcast, we talked a little bit about, there was a CBS News article that was like the horrors of TMJ surgery, which again, it's like always like a nuanced, issue of like, well, was that person a good candidate, or like who did the surgery, what fees?
Yeah. That's exactly how I
But
feel about like the tongue tie. There's been recent articles that came forward about that. And it's the same thing. When things are done improperly, the results are not optimal, and it gives the entire thing a bad name.
There like an MIT article that was like, why are we cutting all of their infants' tongues? And, it was just like a big uproar. So same thing, kind of bait.
Yeah, it's tough. But I think going back to your original question about getting our dental partners on board, I am so lucky for the people that have came before me here in Houston. I came into an already established system. I've watched a lot of my referral partners grow. It's been crazy that I don't have to go to people and beg and ask. Very rarely, every now and then I have to say, please take my opinion into consideration as you make decisions. But I have been so lucky that I actually feel like I learned from the dental providers that we have here. We have an Airway study club that we do quarterly, and it includes dentists, orthodontists, ENTs, osteopaths, like sleep
I love
specialists,
that.
everything. It's incredible. A jaw surgeon is one of the people that's speaking at the upcoming event. And it's just, I know that I'm lucky because I hear how it is in other areas, but it has been, I can't imagine doing this anywhere else because it is just so seamless and so easy. And providers come to these Airway study clubs with all levels of experience. So there's people who are well versed, and then there's practitioners that are just trying to dip their toes in. I actually invited my personal dentist. They just got a laser, and I was like, you should come to the Airway study club, because him and his wife own the practice, and they both are looking to get more into it and learn more information. So we're very lucky.
That's great.
Yeah.
Well, give a shout out to who all's in your Airway study club. And
Gosh, so many. So Susie Q, she is the organizer of all things here at Airway Study Club. She does an amazing job pulling people together. She is an RDH and just has incredible knowledge. She's a big sleep person. So for my adults that are having sleep issues, she's my go-to. Another one is Catherine Kangas at Integrative Myo. She has been a mentor to me since I met her 2 years ago. She's also a registered dental hygienist, but she has so much knowledge about adults specifically that I find myself going to her very frequently. I would not be the speech therapist or myofunctional therapist that I am without Christy Gatto. She's the boss that I mentioned earlier who kind of introduced me into this world. And I took her intro class, and I text with her very frequently, asking her questions about patients. I really feel like she's written books. She is one of the most knowledgeable people that I know in this community. But one of my favorite parts is that it just keeps growing. I've recently connected with Ashley Perkins, who moved here from Louisiana. She's a myofunctional therapist and speech therapist. We got coffee and right into the group. She's at our study clubs. She's doing presentations with other providers. We're really, really lucky to have it here.
I love that.
I could talk about it all day.
That's the key, is really just establishing those interdisciplinary teams in your community. And sometimes it's not easy, but when you do find your people, it's a great way to share case studies and just be able to work collaboratively together. I think that's so fantastic.
It really
So
is.
that's awesome. Well, give a shout out to, what do you have coming up that you're really excited about? Do you have any events that you're going to be speaking at, or
I actually
we'll
have,
link all of the
yeah,
things?
I have nothing on my plate right now, which is the biggest sigh of relief. This new year has been kind of pedal to the metal all year. So I am most looking forward to just catching my breath this summer. But I am accepting new clients both in person and virtually in the state of Texas. I also just got my license approved for the state of New York, so I'm able to see patients in both states. I also have a wonderful dental hygienist on my team who does virtual myofunctional therapists throughout the US. So we are able to service a lot of different people, and we would love to work with you, love to set up a consultation, see if you're a good fit for us. Yeah, we're just excited to take a breath.
I love that. Well, and I have people on Instagram reaching out all the time, like, do you know someone here? Do you know someone there? So I love just having almost like a directory of different, groups in the myo space that you can refer to. One of the things I noticed too when I spoke at one of our big dental conventions is that, a lot of people are really excited. Like you said, RDHs are interested in getting certified. Who would you recommend if you have someone who's like new to the myo space and wanting to get certified?
I would 100% recommend Christy Gatto's course. She does in-person fully, and she also does some hybrid courses. So it's nice. When I took my course, she taught 2 in Houston that year, but I decided to make a birthday trip out of it. And I went and took her course in Napa, and it was so fun, but I felt like I learned so much. And one of my favorite parts about it was how individualized she, creates the program. A lot of times we have this conversation with all my RDH friends a lot, that speech therapists are a little bit more gray, go with the flow. RDHs are very used to like protocols and doing things in a specific order. So that's one of the ways that we feel like we really learn and lean on each other. But it can be very easy to fall into this is a myofunctional program. And I loved that Christy just drilled that everything is individualized. People ask me that all the time. Oh, what's your myo program like? I'm like, I don't have a myo program. I have a myo program for every individual client that I see. But there's no need to start at the bottom. If they've already got some foundational skills, we can just skip that and move on to what they actually need. So Christy is wonderful. She teaches all over the US, and that's definitely where it would start.
I love that. Well, Courtney, thank you so much for being on Jaw Talk with me today. This was so fun to talk myo and talk about your experience. And like I said, we'll link all of your information in the show notes so people can find you, give you a shout out on social media. So thank you again for being on Jaw Talk.
Perfect. Thank you for having me. And Instagram is the easiest way to reach me. It's very in my 30s of me, but that is like my main form of communication. So you can find information on there and chat instead of consultations directly in the DMs.
Awesome. Thank you so much.
Thanks for tuning into Jaw Talk Podcast. Remember, you can find all of our info in the show notes. And if you like the podcast, consider being a paid subscriber. For only $3 a month, you can help support the show. Thanks a lot for listening. And until next time, stay humble, stay curious.